Hi everyone. So today's topic in our presentation would be multiple sclerosis. Just to start off, what is multiple sclerosis? Multiple sclerosis is a disease in the central nervous system in which the connective flow of information of the brain throughout the body is being interrupted. Basically, the central nervous system includes the brain and the spinal cord. So most of the information we get as far as like body functioning and movement and motor control comes from the brain and gets sent through the entire body, especially like through the spinal cord. So in multiple sclerosis, or also known as MS, that is being interrupted. MS is also known as an unknown and unpredictable disease that will trigger the immunity system to attack the central nervous system at an abnormal rate. So it could be during various episodes. It could be constant flare-ups, stuff like that. MS does result in nerve damage. In the next slide, I will show like the difference between a normal nerve and a damaged nerve. Basically, the myelin sheath, which is the protective layer of fiber on nerves, is damaged or altered and can no longer be able to send messages within the central nervous system. And then the development of scar tissue in multiple areas causes severe neurological symptoms to form, which is how the disease got its name, multiple sclerosis. There are 4 different types of multiple sclerosis. There is clinically isolated syndrome, also known as CIS. This is a single occurrence of neurologic symptoms that can last up to 24 hours or more and is only happening in that single occurrence. It results in inflammation or the deterioration of the myelin sheath, which is the protection of the nerve fibers. The second is relapsing remitting, which is RRMS. It is the most common type of multiple sclerosis in the medical field. It involves mild to severe symptoms of relapses or flare-ups that can last longer and at a faster period. The third is primary progressive MS, which is a slow progression of symptoms that may stay at the same intensity, meaning in other words that during primary progressive, you may experience symptoms that are not as harsh or not as severe, but they won't continue to worsen. They'll just stay at the same rate that they are. Secondary progressive is involving different features of what relapse and remitting MS is, and basically follows up with more flare-ups and more recovery periods. So as you can see in this diagram, on the left-hand side, this is a normal nerve, which includes a normal-looking nucleus, the dendrites, and then as you can see, the myelin sheath is intact. On this right-hand side, which is the diagram for multiple sclerosis, as you can see, the myelin sheath is damaged and shriveled up, which is how multiple sclerosis has its name. Complications of MS. Complications of MS includes different symptoms of MS that a patient experiences on a regular or during different episodes or periods. There is numbness or tingling in one or more limbs, either on one side of the body or at a constant rate. There are electric shocks within the neck and the lumbar region, which is the spinal cord. Constant tremors, blurred or loss of vision in one eye, slurred speech, fatigue, or problems with bowel movement functioning. The diagnosis of MS is made by a neurologist. Many neurologists do use the McDonald criteria method, which is where professionals run a certain number of tests and use the test as a checklist just to make sure that the patient does indeed have MS. Tests used for diagnosis do vary. There are neurological examination, which is simple collection of vital signs such as body weight, blood tests, as well, magnetic resonance imaging, which is MRI, and basically neurologists take pictures of the brain and the spinal cord just to make sure everything is intact. If they see complications within the MRI, that means there is a diagnosis of MS that will occur. Blood testing, which is an example of neurological examination. Lumbar puncture, which is basically in relation to spinal tapping. Basically, neurologists tap or examine the one lumbar region just to make sure there are no complications in that area specifically. A painless test is a kind of test that basically focuses on measuring the amount of pain one is in when they do certain movements and tests. Medicine and treatments for MS includes basically overall therapy. There are drug-based treatments and there are non-drug-based treatments. Over on the left-hand side, where basic treatments, there is interferon beta or glutamate acetate. Escalating treatments are mitoxantrone or natalizumab or fingolimod, and also symptomatic treatments, which help reduce the worsening of different symptoms when having MS. There are non-drug-based treatments, which are basically just overall therapy, physical therapy, physiotherapy, ergotherapy, logopedics, rehab, and also possibly exercise, which is a very good type of treatment. And then there are other treatments such as sociotherapy and psychotherapy. There are many different statistics, but a few of these statistics do stick out. From Molt, who is in the practical neurology department, he states the estimated prevalence of multiple sclerosis is 1 million adults in the United States. Stated by MS Discovery Forum, an estimated 200 new cases are diagnosed each week in the U.S. Another statistic stated by the National Institute of Neurological Disorders and Stroke, people with relatively higher levels of vitamin D are less likely to develop MS. Another statistic stated by National Multiple Sclerosis Society, about 5,000 children and teens currently live with MS in the United States, and about 10,000 children live with it worldwide. And in these two diagrams basically shows the different cases present in the different, for example, like on this left-hand side, it shows the different areas of the United States that have higher cases than others. In the northern states, they have 377 cases. In the Midwest states, there are 353 cases. In the southern states, there are 277 cases. In the western states, there are 277 cases as well. And then on this right-hand side, it shows the different frequency of MS types, which is which ones are untreated and which ones are most likely treated. Definitely a difference in rate. It says for 85% are diagnosed with the relapsing remitting MS, which we said was the most common type of MS there is in the world. Why people with MS should exercise. Basically, the overall benefits of exercise for those with MS include improving overall fitness, improving endurance and strength in the arms and legs, enhancing the control of bowel and bladder functioning, decreases fatigue, and boosts overall mood. Now, there is one case study I made as an example as to how one with MS can able to function and use exercise as medicine as a treatment. So a background for our case study is a 30-year-old female, a sedentary lifestyle, which means somewhat exercising, somewhat in a good state of mind, somewhat in an overall healthy lifestyle. This female does have a past family medical history of diabetes and high blood pressure, so those are certain factors that we should take in mind when prescribing an exercise prescription and exercise testing as well. This patient was diagnosed in 2020. They have suffered loss of vision in one eye during their diagnosis, weak limbs, and also slurred speech. The different exercise testing that I decided to use for the patient includes aerobic, resistance, strength, balance, and flexibility. For aerobic, I decided to pick the 6-minute walk test just to determine the patient's overall VO2 max and just to see how they would be able to maneuver while walking, while jogging, just doing overall certain tasks, usually in the daily life. Resistance, 30-second chair stand, which will test for upper body strength due to the fact that they did suffer a symptom of having weak limbs when they were diagnosed with MS. Strength, hand grip dynamometer, which measures the muscular strength in the dominant hands or in the hands overall. Balance, the standing stork test, which will help measure the amount of time the client is able to hold themselves on one leg at a time. Flexibility would be the sit and reach test, and this would determine the patient's overall range of motion. Here are different fit principle recommendations. This is basically how we would determine what, where, and how each patient would maneuver, especially one with MS. Specifically, our 30-year-old female patient who has been diagnosed with MS for 2 years now. So the EDSS score is basically the Expanded Disability Status Score, and each different score will determine and help us figure out how many minutes a week, how many steps, basically overall what they're doing during their activities, how much they're doing. So for example, EDSS score with 0 to 6.5, they would do 150 minutes per week, 7,500 steps per day. An example of different activities they would do would be walking, gardening, road cycling, hiking, etc. Some notes that we should consider are that all activity, including work, housework, hobbies, and sporting activities, count towards their goal. So basically, we're trying to work on doing rehabilitation with our patient just to make sure that they are able to work through everyday life activities so they're on the right path. And here is a recommended exercise prescription. Usually the only 3 factors or 3 exercise categories we'll be working on are the general aerobic exercise, advanced aerobic exercise, and general resistance exercise. So really we're only working on more so aerobic and resistance exercise. For aerobic exercise, we would do 2 to 3 days per week. The duration will be 10 to 30 minutes over time. These activities will be performed at a moderate intensity, more so 50 to 60% of their heart rate reserve. Moderate intensity of exercise is usually between 11 and 13 on the 20-point RPE scale. And yes, advanced aerobic exercise will be 5 days per week. The duration of the exercise will be about 40 minutes. Intensity of each exercise can approach 15 on the 20-point RPE scale. And then we will also work at a moderate intensity, which is 70% or 80% of their heart rate reserve. General resistance exercise will be 2 to 3 days per week. The exercise should range from about 1 to 3 sets with 8 to 15 reps for each exercise. They should try to aim to do 5 to 10 exercises. If they seem to be as though they will not be able to continue exercises, kind of reduce the amount of exercises just so the patient won't worsen their condition. You can pick a resistance that you can finish from 8 to 15 repetitions. Like I said before, just make sure the patient does not overwork themselves to the point of exhaustion. Exercise training consideration is to monitor the amount of exertion and time that the patient's body is doing during workouts. That means they could use the 2-hour rule. In other words, you can examine how the body is functioning after 2 hours of exercise just to determine how long the patient should be exercising on a consistent basis. Create a good recovery time so we have enough time to cool down. Usually a good amount of recovery time after each kind of exercising, meaning after aerobic exercise, then going into resistance. That in between time should be about 2 to 4 minutes just to make sure that the patient is able to continue working out. Helping patients stay motivated by finding something that is meaningful to them. Just basically create goals that the patient is able to relate to and able to work towards. So you could use, for example, the SMART goal aspect, which is basically using the SMART goal as a way to work on advancing into larger goals like that. Provide patient different ways to incorporate exercise in their everyday lives. Instead of just going to visit you, they can take classes at a gym. They could involve in at-home exercises they can watch online, or they can do regular routine things such as walking and jogging. Staying hydrated, very important. Being overheated can definitely increase the symptoms of MS. Drinking water at a consistent rate and pace is very essential. Making good use of resources such as if there are fans or ventilation systems where you are exercising at, just to make sure that the patient is in a cool environment. And for more information, if you or a loved one is experiencing symptoms or episodes of MS, please use the following resources. There is www.nationalmssociety.org, there's www.everydayhealth.com, and there is braincenter.org for more resources on multiple sclerosis. Thank you.